Hi. So today we're going to try to understand two more terms, and that is lung compliance and airway resistance. So lung compliance refers to the lung's ability to expand in response to pressure. Now scientifically it is given by the formula change in volume over change in transpulmonary pressure. Now, but then what is transpulmonary pressure? First, let's try to define alveolar pressure for that. Alveolar pressure is the pressure within the air sac or the alveoli of the lungs. And the pleural pressure is the pressure within the thin fluid-filled space between the lungs and the chest wall. So transpulmonary pressure is the difference between the two. Now, why is this important? Because transpulmonary pressure, in simple terms, is the pressure needed to stretch the lungs or inflate the lungs. So, coming back to compliance, in again simple terms, it's described as how stretchy the lungs are. So low compliance means the lungs are stiff and difficult to inflate, much like trying to blow up a thick, rigid balloon, right? So conditions like pulmonary fibrosis, acute respiratory distress syndrome, ARDS, or severe pulmonary edema can all decrease the lung compliance. High compliance doesn't necessarily mean it is the lungs are working efficiently. It basically is saying it's abnormally easy to inflate, but then it may have issues recoiling properly, for instance in emphysema. So for those patients, exhalation becomes difficult. So now let's look at airway resistance. Airway resistance is the resistance to airflow within the airway, primarily influenced by the diameter of the airway. So the thinner or the smaller they are, more turbulent the flow is. And it is given by the formula change in the pressure over flow. So in everyday term, we can describe it as how hard it is for the air to flow through the bronchial tubes. Now, high resistance occurs when airways are narrowed or obstructed, such as in asthma, bronchospasm, when there is airway secretions, or if the endotracheal tube is kinked or blocked. Factors like the viscosity of the gas, the length of the airway, the degree of turbulence also affect the resistance. So now what is the clinical takeaway here is when the patient is under anesthesia, mechanically ventilated by us, we have to make sure that they are very well oxygenated. And this requires thorough knowledge of patient's medical history, surgical history, any other issues going on. So you may need to increase the inspiratory pressure or adjust the tidal volumes so that you're efficiently able to manage ventilation and oxygenation in this patient. So failure to adjust those can result in barotrauma or hypoventilation. So either which way you're affecting the gas exchange severely. So the key point here is always monitor changes in the airway pressures and the ventilator waveforms because they offer immediate clues about compliance and resistance issues. Thank you.